All right, good morning, everybody.
Good morning.
I'm grateful to be here today for this exciting announcement connected to our groundbreaking Medical Debt Relief Initiative, or MDRI. Before I get started, I'd like to thank and acknowledge our partners, many of whom are with us today. David Evers is here representing Cook County Commissioner Dennis Deere, who cannot be with us. Allison Sesso, who's President and CEO of RIP Medical Debt. Dr. Ngozi Ezike, who's President and CEO of Mount Sinai, and there are two board members here, Board Chair Brian Dolan and Abraham Morgan, who's a board member. Thor Thordarson, who's President and CEO of Advent Health, Great Lakes region. Tessa Anuishki, CEO of Loretta Hospital, and Amy Gavedo Medina. I'd like to acknowledge the staff who were critical in bringing this matter to our attention. Otis Story, who's Deputy Chief of Staff, Nish Tirakavi, who's Legislative Coordinator, and Mara Hennigan, who is our former Director of Policy. I want to thank all of them for their good work. We're standing today with our partners to announce the first tranche of medical debt abolishment through MDRI. Using federal funds provided by the American Rescue Plan Act, and in partnership with RIP Medical Debt, Cook County has successfully acquired and erased nearly $80 million in medical debt. We've spent only a fraction of that amount, $800,000, less than $1 million, to do it. This will benefit over 72,000 Cook County families, with many more to come. I want to thank President Joe Biden, who of course initiated the American Rescue Plan Act, which brought $1 billion to Cook County. Today is not possible without those federal resources. We're proud to provide this relief to Cook County families because medical debt is a growing problem in both the United States and Cook County. Nationally, there are 100 million adults with medical debt totaling $195 billion. In Cook County alone, over 14% of households have some form of medical debt. And as is true of most issues of poverty and marginalization in this country, people of color are disproportionately impacted. Black people are 50% more likely, and Latinos 35% more likely to hold medical debt compared to white people nationally. The impacts and outcomes of these facts are clear. Medical debt is the leading cause of bankruptcy in the United States. One more time, medical debt is the leading cause of bankruptcy in this country. It also leads to poor credit, which undermines employment prospects, the ability to access affordable housing, and ultimately achieve upward mobility. Medical debt also imposes psychological and physical burdens on its holders, and in many circumstances, financially vulnerable people with medical debt suffer from unnecessary stress that impacts their mental health. It's also been proven that medical debt holders often delay seeking preventative and serious medical treatment for health issues out of fear of further increasing their debt. These are serious issues, and that's why Cook County is tackling the problem directly. By providing relief to residents who need it most, we're lifting a heavy burden. We believe that we will allow people to seek medical treatment that they need through this effort. Additionally, we'll work to ensure credit agencies are contacted to remove medical debt from credit scores. Improved credit scores will enable our residents to take advantage of loans and mortgages. Families can consider plans for higher education. People can build back their emergency savings to prepare for the future. Families, finances, and futures can be changed by giving people a chance to clear up their debt. We're already seeing the impact of this in people's lives. People like Amy, who will share a story with us. We're proud of the work that it's taken to get to this point, but this is just the beginning. Again, with just $800,000, less than $1 million, we've been able to abolish nearly $80 million in medical debt. With roughly $10 million remaining, our program has the potential to abolish $1 billion and help hundreds of families in Cook County achieve a stable financial foundation. We look forward to continuing this good work with RIP Medical Debt to provide more relief to Cook County's most vulnerable families and communities. Now, I'm going to ask people to come to the podium. David Evers, Allison Sesso, Dr. Ezike, Thor Thorderson, Tussa, did I say it right? Tesa, and then we'll have Amy be with us virtually. Okay, I would ask that you introduce the person who follows you. David, please come to the podium.
Thank you, Madam President, and good morning, everyone. My name is David Evers, representing Cook County Commissioner Dennis Deere of the 2nd County District. Commissioner Deere is the chair of the Health and Hospital Committee on the County Board, as well as the vice president of Cook County Health. He's grateful today for this program. Looking at the statistics and looking at all the talking points, one thing is clear is that this administration cares about people. We're talking about releasing debt, giving people a state of mind, as well as understanding that this type of debt hits our minority communities the most. And so this administration, this county board, we saw that people needed our help, and that's exactly what we did. So thank you, President Preckwinkle, for your leadership on this. Thank you to Commissioner Deere and the Board of Commissioners. You guys care about people, and you will continue to do so. Thank you. Next, we'll have Allison Sesso, President and CEO of RIPMD.
Thank you. Thank you so much, and thank you so much to Cook County and the President for your leadership. I have to say, Cook County is a trendsetter. There's been many other cities, states, and counties that have knocked on our door since Cook County took this innovative approach with the American Recovery Plan dollars to relieve medical debt. So we're thrilled to be focused here first and to be really on the ground working and doing our first debt relief through a government contract in this way. Our new model is completely unique. There's no other nonprofit that does the work that we do. It is leveraging the for-profit debt market for a charitable purpose, this medical debt relief. What we do is we take the pricing that's available through the for-profit debt market, and we take $1 and relieve as much as $100 of medical debt or more at times. We've abolished $8.8 billion of debt for over 5.5 million people across the country using this model. Healthcare providers, like the ones that are here today, work with us because they understand that medical debt is fundamentally hurting people. It's undermining their missions to provide health and well-being for individuals. It creates hypertension for people. It creates high blood pressure because the stress is significant and the mental strain on people. So by lifting this burden for pennies on the dollar, we're really doing a lot of good for a low cost. And we do invite Cook County hospitals across that are serving Cook County to come to the table. We're excited that we have many more in the works, and there'll be much more debt relief followed by the debt relief that we're talking about today. While we know we're not the final answer to this problem of medical debt, we certainly need systemic solutions. We do know that the relief is important to provide to people today, and people can't wait for bigger policy changes. So, as I like to say, we can walk and chew gum at the same time. We can both do this debt relief and think about bigger policy changes on the horizon. The people that received letters, like Amy, who you're going to hear from in a little bit, often are in disbelief that this is a real thing, and I want to assure people that it is real. You can't apply for this. This is something that happens with no action. We get the debt from the hospitals, and we notify you that the debt's been relieved. When they realize that it is real, I will say often the reaction is that they're brought to tears because the relief is palpable for them. So that's an important thing to pay attention to, that this is real for people and it feels overwhelming, and the sense of relief brings tears of joy and relief to them. As we talked about, we'll be relieving $80 million of debt already, with more to come. The majority of the people did have insurance, so I do think that's an important element to highlight, because it shows that the medical debt problem is not just an uninsured issue, but an underinsured issue. Majority of people were 300% of poverty or below, although we do focus on relief for people 400% of poverty below, and if the debt is 5% or more of their income. So I just want to thank everybody here today, and for Cook County for their leadership on this issue. Okay, so next we have Dr. Ezike, President and CEO of Sinai Chicago.
Thank you.
Thank you, Allison, and good morning, everyone.
Good morning.
I am Dr. Ngozi Ezike, President and CEO of Sinai Chicago, and I'm very honored and pleased to be joining you all this morning. I came to Sinai just about a year ago, and just to carry on my life's work of promoting health equity. And for more than 100 years, Sinai Chicago has cared for the most underserved communities in our city. And our caregivers live on the front line of all the many battles that are faced: gun violence, racism, health inequity, economic inequity, and COVID. And we're all committed to a mission of serving our patients and our communities, working not just to heal wounds, but also addressing the root causes of the hurt and distress. So there's been a lot of discussion about health equity and health disparities. We've all heard that the life expectancy of people living on certain neighborhoods is 10 to 15 years less than those living in maybe more wealthier neighborhoods of our community. And the reality is that COVID has set us back even further, and over the last 3 years, unfortunately, the life expectancy has actually declined due to many factors: COVID, the opioid crisis, the mental health crisis, et cetera, but also because of increased economic disparity. Financial insecurity, such as that caused by medical debt, is a significant social determinant of health that disproportionately impacts people of color. Again, as you've heard, making them less likely to seek the care that they actually need because of all these concerns about the costs. At Sinai, we've always been committed to addressing the social determinants of health, which cause our communities on the west and south sides to face that disproportionate share of chronic illness and economic distress. Removing medical debt not only addresses the inequity by removing that barrier to care, but it also drives better health outcomes in our most challenged communities. If we truly care about equity, then we need to be holistic in identifying all these challenges that people are facing, and this is a major one. For safety nets like Sinai Chicago, unpaid medical bills have a significant impact on our bottom line. We provided over $50 million in charity care just last year. Removing medical debt not only addresses inequity with improved economic security in our most challenged communities, but it also improves the financial stability of the institutions like Sinai that are dedicated to providing that care in the communities that need it most. We need to be looking at what impacts people's health: jobs, housing, healthy food, safe neighborhoods, transportation. But this financial stability is a key factor. The RIP medical debt program is an incredible example of innovation to help ensure that everyone has access to quality care, because limited financial resources should not mean limited lifespan. All Chicagoans and all Cook County residents deserve great health, no matter which part of the county they live in. It's a fundamental piece of the mission at Sinai, and I know that it's a part of the collective commitment by everyone. We are all committed to social justice for our communities, for our county, and for each other. Thank you so much. And with that, I would like to pass the podium to Tor Torstensen, President and CEO of Advent Health, the Great Lakes region.
Thank you, Dr. Ezike. I'm grateful to be here today and represent UChicago Medicine, Advent Health, Great Lakes region, and announce our participation in this program. I also want to thank President Preckwinkle and Allison for their part in this, particularly for the funding of the program and bringing it to our attention. We obviously, as not-for-profit hospitals, we do have a number of programs to help people with cost of health care, but there are just too many people who fall through the cracks. And I can tell you, even with good insurance, this can happen to all of us. We are only one healthcare event away from financial devastation. And really, we shouldn't have to choose between good healthcare and financial devastation. That's not a fair choice. And so anything that we can do to help, we will, and we're grateful to participate in this. I can tell you just from a personal experience, as my wife and I had very premature twins 34 years ago. The number of bills that come home along with the kids and the size was astronomical. And I can tell you, it's eye-watering. There's no way we could have paid for this. Thankfully, we had good insurance. I was a registered nurse, still am. My wife a teacher. But even on that good salary and with good insurance, we really struggled. And we would have been still probably paying for some of this today if it wasn't for, a group of physicians who basically waived the major portion of their fees. So, all of us are very close to having health care. All it takes is one event, and we'll be in that seat. So I can only imagine folks on the margin who are struggling. We don't want them to have to choose between good health and financial devastation. So we're happy to be here, appreciate the program, and looking forward to seeing this grow. So thank you.
Thank you. Thank you.
That's okay. Sorry. That's okay. Good morning. Good morning. I'm Tesa Enuwishki, President and CEO for Loretto Hospital. So beyond the label of safety net, Loretto Hospital, like other safety net hospitals around the cities, are the net that provides safety and support for our communities, particularly those in need of medical care. We believe that collective wellness starts with testing and treatment. However, in zip codes that have been historically under-resourced and overlooked, barriers to accessible quality health care are layered and complex. The social and structural roadblocks to health services include proximity, affordability, availability, and impact communities of color more severely. The families already are experiencing hardship. Medical debt drains absent resources and fatigues those that are already uninsured or underinsured. As a result, chronic conditions that require ongoing medical attention often go untreated and directly influence the steady decline of life expectancy rates. However, removing the burden of medical debt is both gracious and groundbreaking. This relief initiative positions people over profit and is aligned with Loretto Hospital's mission, as well as all the other healthcare providers, to restore dignity to families and to healthcare. We are overjoyed for our patients and all the other patients that will receive this gift. It has been said that the time for justice and the time for equality is always now. President Preckwinkle and MDRI, thank you so much for meeting this moment with relief and being true advocates for the residents of Cook County. And Loretto Hospital looks forward to continuing to be a blessing to the communities that we serve. Thank you so much.
Thank you. Thank you very much. Tesa, thank you.
Amy is on the line right now. 1 second while we get set up.
This is Amy Quavado Medina, right? Okay.
All right, Amy, do you want to go ahead?
All right, Amy, do you want to go ahead? Amy, are you with us?
Yes, I am here. Hello, my name is Amy Medina Cavedo, and I am a resident of Cook County. Yes, I am a longtime resident of Cook County for the majority of my life, and I am a recipient of the assistance from the RIP medical assistance.
Thank you, Amy. Can you share a little bit about what the impact of the elimination of your medical debt has been on you and your family?
Yes, so it was a very pleasant surprise because I am a person who has had a chronic illness for over 10 years of my life. I have type 1 diabetes. And when I did receive the letter from RIP Medical that it brought me a sense of hope. It was very unexpected, but it is a very nice program, and I am glad that Cook County is participating in this.
Thank you. Thank you, Amy. Thank you for joining us. We're grateful.
Thank you.
All right?
All right, now we'll take some questions. We'll start with the reporters in the room. AD, Tribune, do you have anything?
step up at once. Four.
Yeah, sure. No, it was a very simple and easy conversation. Our mission is to extend the healing ministry of Christ. It's very much aligned with the mission of this program. We want to help people, and so yes, we participate. We will write off part of this. There's funding that comes in and helps the folks in addition to, so it's very much aligned with who we are and what we want to do, and I'm sure the rest of my colleagues will share that. This was an easy decision.
Thank you.
It's very rare that you have opportunities that are just win-win opportunities, and being able to cancel debt for people, erase that barrier to care, erase that financial burden, and be able to support the hospitals that provide that care, it's absolutely a no-brainer, and we're so grateful for this really innovative solution that Allison and her nonprofit have created for us to take advantage of.
Has it helped? Has it started conversations about changing billing practices at all, especially for people who can't afford this care in the first place?
So, I believe in universal health care. I've never hidden that fact. Until such time that we get to that state of grace in this country, we have to have interventions like this one to provide help, not just for individuals and their families, but also for the institutions that provide care.
Yeah, you talked about how this program aims to help people who are underinsured and how wealthy people.
You could come up here. It's kind of, it's like playing peekaboo.
Thank you. How this program is intended to help people who may have insurance, but it may not be complete, they might be underinsured. Are you talking about are you hoping to roll out programs that help people become fully insured in a way that helps them cover these kinds of costs in the future?
Okay, so let me go back and say, I believe in universal health care. This is something that has to be done at the federal level, however. And until such time as the federal government in its wisdom sees fit to provide universal health care for all of our people, as I said, we have to figure out how we're going to address the challenges we face in innovative ways, and we're grateful for RIP Medical Debt because they have come up with one.
No, that's all. Thank you.
Kristen from WBZ, do you have anything?
Yes, thanks so much for doing this. Can you just briefly remind us how this works? Like how the county can use, $12 million in ARPA funding to abolish up to $1 billion in debt?
Okay, I'll ask Allison to come forward, but basically, as we looked at how we were going to allocate resources that came to us from the federal government, as you know, we did a lot of more traditional things, but we also have a guaranteed income pilot, which is innovative, and this medical debt initiative, which at the time we engaged with RIP, we were the only government entity that chose to do so. So it's a matter of having the federal resources and then staff and partners that have great ideas about how we can help our people recover from COVID and regain more financial stability. Allison?
Sure. So I know it's not an easy thing to understand for your average person. It took me some time when I first came on at RIP Medical Debt to understand how the model actually works about 3 years ago. At the end of the day, there is a for-profit market for debt buying, and hospitals can and other providers can sell their debt to for-profit debt buyers. They do that for pennies on the dollar because the fact of the matter is the majority of people whose bad debt they're selling can't pay, so they have to sort of make sure that the amount that they pay initially for the face value of the debt is very, very low so that they can make a return on their investment. We take advantage of that model, that pricing that is set by the for-profit market, and we use it for a charitable purpose. So I'm not making money back. I'm relieving the debt when it gets in my hands. And so that's how we're able to turn $1 into $100 of medical debt relief, because we're leveraging a for-profit market that exists.
Yeah, I did just have a few more questions, if that's okay. Can you tell me a little bit about how people found out? So they essentially
Sure, I can talk about how people learn about the program. So we get data from the providers when we buy the debt, and we do buy data, just so everybody knows, in order to from FinThrive, which is formerly part of TransUnion Health Care. And what we do is we take that data, and it includes their updated addresses and things like that. We work really hard to get the most updated information on where people live, and we send them letters. We have an automated system that we've built. It's why it's so efficient and why every dollar gets stretched so far, because we have an automated debt engine, we call it, that actually does the work in the background, and we are able to send letters en masse to individuals. But again, it's after we get our hands on the debt, after the debt has been relieved. And what's nice about this is there's so many social interventions that require people to fill out applications or take an action. This one does not. And so the debt relief really happens without any work on the person's own behalf, which is really helpful, especially for marginalized communities.
Okay, thank you. And then can you just give us a little sense of, tell us about the people whose debt has been erased so far? You had mentioned, Allison, for example, that majority of people do have insurance. Can you tell us, like what type of insurance? Do you mean Medicaid versus private? Do you have any demographic data about folks, or perhaps, where they live about?
Yes, so in terms of, we do a deep analysis that we do provide as part of our contract with Cook County that shows how many people were insured, what their poverty level is. So as I mentioned, majority are 300% of poverty or below. It does show the race data. The race data is hard to come by in general, but we have roughly 50% of the information on 50% of the people who we help so far, and 48% of them are Black, to give you an example. We do also have, right up here, if you were in the room, you might be able to see it, or maybe you can see it online. There's a top 10 zip codes of people where they're located in terms of how they've been helped. So we do break this down and have that kind of data that's available to Cook County. We break down age. I think it was roughly 50% are 45 and above, roughly 45% are below 45. So that's some basic high-level information off the top of my head. But again, we provide much more detail to Cook County, and I'm happy to follow up and provide more of that detail if you want to dig in.
Yeah, Kristen, look out for
Okay,
some
thank you.
of that in our release that's coming out soon.
Okay, great. And then I just have one more question. The goal is still to abolish up to $1 billion in debt, right? Can you give us a sense of the timeline of how long that might take?
Sure, this is Allison again. So how long will it take to abolish $1 billion of debt? The thing is, it does take a little while to get hospitals familiar with our program, because we are a sort of weird animal. Nobody's heard of this before. And it does take, and frankly, hospitals are bureaucracies, and you have to sort of weed your way through them. But we have a lot of hospitals that are lined up and excited about this. The contract is for 3 years, and so we expect to get that done within the 3 years. We've done the analysis. The debt is certainly out there, and we just need to get our hands on it. And I think we're doing really well now with the hospitals. So I think it'll happen within that time frame.
Just a second. With any innovative program like this, the hardest thing is to get the first institution on board. And then once you have folks who are committed to it, there's kind of a socialization of it. And I think we'll see more hospitals come on board, and that'll help us meet our goals. Yes, now your question?
I was just going to ask, so beyond Cook County Health, can you name the other hospitals who have contracts now with RIT Medical Debt, or even just the number?
Okay, so first of all, Cook County Health does not have a contract with them. We can't use the federal money to pay ourselves. So we're using the federal money to support other healthcare providers, hospitals, physician groups, who are willing to work with us. So please understand, the money doesn't come back to Cook County Health, okay? But Allison, you want to speak to that?
Yeah, sure. So the hospital, we have a lot of hospitals lined up. I will say that it's up to the hospitals to determine whether or not they want to announce publicly that they are relieving debt. Obviously, the hospitals that are here today do have BAAs with RIP medical debt and are willing to talk about their work. We do have we have contracts with other hospitals that are not represented here today as well. I hope that answers your question. But we have lots of discussions going on, and like I said, it does take a little while for everyone to sign the BAA, but we have others signed that are not publicly here with us today.
Tell people what a BAA is.
Oh, sorry. Thank you. It's my jargon. So it's a business associates agreement. It's actually related to HIPAA compliance and being able to, and HIPAA is a law, federal law, that is in place to protect patient data. And in order to do this, we have to get patient data. So we have to sign these agreements with hospitals in order to be able to review and analyze the patient data and get that. And so that's why those agreements are so important as a first step in this process.